So hello guys, part B, we will see the general coding guidelines. First one we will see locating a code in the ICD-10 It means what? You know alphabetical index, tabular list, you know in the last session what is mean that. But what is the locating of the code in the ICD-10 or level of detail coding? So I am showing you what's the format. If you receive one record at that time, we will how to see in that. So firstly in the record we will see the patient name do dob, MRN number, account number, or any other patient identifier. Okay, this is the first we will see. After that, mention chief complaint, then reason for visit, HPI, physical exam, assessment plan, sometimes mention problem list or past medical history, PMH. Okay, then last section we will see the provider signature and credential. This is requirements to check in the insurance record or encounter. So this all is must in the encounter. After we will checking this information, so we will proceed the coding. So what is mean chief complaints? This is you know all guys. This is the patient identifier. It means name, DOB, date of birth, MRN number, account number is the insurance part. After we will see the this patient identifier is matched to the exact patient. Then we will check the SOAP format. SOAP format it means here HPI, physical exam, assessment plan. That this is all active headers. This means patient coming to the hospital and taking the service. That's why this is the active section. And chief complaint reason for visit, problem list, PMS. This is a past section we will consider it. So what is mean by chief complaint? So patient coming from the hospital, cough, for any symptoms we will coming patient coming for the hospital. After the reason for visit, severe chest pain, that's why patient coming in the hospital. In the HPI section also mention the same, patient coming for the severe chest pain, uh, past 2 days, sorry, past 2 days she suffer from the cough and chest pain. That's all patient descriptions or patient sentence mentioned in the HPI section. Physical examination means doctor sees to the patient, and after what examine doctor what examine the patient, that all details mentioned in the physical examination. After the conclusion, doctor gives the assessment, patient having asthma or COPD. it means chronic obstructive pulmonary disease. After that, doctor prescribes some medication that is albuterol or any other inhaler. Problem this patient past history having the some emphysema, chest pain, that type of problems in past. This is also same, it's approximately same in the sometimes we will differ. After that here patient signature is must, then patient credential also must. Credential it means patient doc sorry provider credential it means provider is MD or DO or APRN or it's a dietitian, registered dietitian or RR means registered nurse. What type of provider we will identify from their credentials. So this is the format we will check in the encounter or medical record. After this all requirements are present or this detail present in the encounter, then we will proceed the coding. Okay, so here level of coding also mentioned locating of ICD-10 here. Code or codes is the series from chapter 8 to chapter 1st to the chapter 22. This is the sequence coding. Sign and symptoms, you know you are the life science background. Sign and symptoms with any disease asthma and their symptoms like chest pain, cough, sneezing. This is the symptoms, signs and symptoms. So here is multiple coding for the single. It means sometimes only symptoms mentioned, chest pain, cough, sneezing, and not mention the diagnosis like asthma or COPD. If that time we will code the sign and symptoms only, because provider cannot diagnose any definitive condition. That time we will code only sign and symptoms. What is acute condition and chronic condition? Acute condition it means life-threatening conditions like that CVA, myocardial infarction, deep vein thrombosis, pulmonary embolism. That condition is a life-threatening to the human. That's why this is the acute conditions. A chronic condition it means it's a long time or long period occur. That means STM, hypertension, DM, diabetes. It's a long time carrying conditions. So this is a chronic conditions. Combination we will also see the I11 it means hypertensive heart failure. So that time we will code I11 as a combination code as well as separate to identify which type of heart failure mentioned. That time we will code I15. So sequela it means late effect. So what is mean by sequela and late effect? It means sometimes patient coming for the paraplegia. That time doctor diagnose this is the sequela effect. What is the sequela effect? How to diagnose the doctor? So doctor diagnoses the patient past doctor checking their past history. So that time having the cerebrovascular accident in the previous 2 years ago. So that time hemiplegia is the late effect of the CVA. So this is the late effect and they have not a definite time. If CVA suffering from the patient last 3 years ago or 5 years ago or 10 years ago is not a definite condition. But patient suffering from the CVA in past history, so hemiplegia is the late effect. impending and life-threatening conditions. It means the acute conditions, DVT, that's the threat to life. Laterality, it means sometimes here I'll mention, I will give you example how to find laterality in the record. Laterality, it means sides. So sometimes here I'm adding the one diagnosis, paraplegia. Okay, and in examination mention left side paraplegia. That that is same also mentioned in the assessment also. So we will check all the records. That time we will check their laterality also. So paraplegia mentioned in assessment. So this is the direct confirmed diagnosis. So we will code, but paraplegia having, if paraplegia only mentioned, those sometimes coder we will take that unspecified code, but their laterality mentioned in the examination. So left side paraplegia is the accurate code. We will take this. If you taking only paraplegia unspecified, so it's L2 marking to error and is spelling issue. So this is the BMI is a condition mentioned syndromes. This concept also you know. Sometimes borderline diagnosis mentioned. Borderline diagnosis, it means patient is inpatient and discharge summary is there. So that time of the discharge, that borderline diagnosis mentioned. Only if the mention borderline DM, so we will check in the software. Here we will go in alphabetical index and so we will check here DM. Okay, diabetes. So E11 9 here. Okay, but borderline DM. So again we will lead in the borderline DMs. Go with the B. Here select borderline. Then you clicking that borderline, and then we will see this is a different code, borderline DM R7310. So we will lead in that sequence only. Firstly, the uh, firstly we identified the condition. What type of condition? This is the index. All conditions sometimes found in the index, but sometimes external causes. External causes mentioned is how to identify some accidental condition or any other part that's laceration, cutting to the knife in your body or hand. That time you will found this is the external cause. Sometimes mentioned drug-induced polyneuropathy. This is a drugs-related condition, so we will search here. Neoplasm, it means cancer. All types of cancer found in that table only. So mostly we will lead in the index. So this is the sequence. We will go the index, then select the initial. What type of disease? Here I am selecting the B, it means borderline. Then border, go with the borderline, and then check that condition is mentioned here. So DM hypertension of time. This is on that 5 conditions mentioned under the borderline. Other condition directly leads to the another code. So this is the concept. Then this is the external cause, so we will search in the external. So you search in that external causes. So here also same, we will select the first initial of the condition, then we will go to the next. Z codes. Z codes it means this is the personal history codes. Some condition in occurs the patient in the past, that time we will use their Z codes. But some exception also here, that is homelessness, inadequate housing, or any encounter supervision care, or any encounter respiratory ventilator. This is the exception code. So others are the all history codes. So multiple site coding, it means 2 or 3 codes. I have one example to show how to multiple site coding, it means what. So you go in alphabetical index, patient having hypertension, chronic kidney disease, as well as chronic heart failure or chronic heart failure only. So that time we will go in the alphabetical index, then do the hypertension H is the H. Okay, hypertension. Next you search here hypertension. If you go in the hypertension, then we will see here cardiorenal, it means cardio means heart and renal means kidney. So here cardiorenal, we will go here stage 4 or any code we will select here I30. So in that combination code, hypertension, CKD and heart failure all are mentioned. This is the combination code. So if you code the I13 that time I15 or that code sequence be here. Okay, this is the specific type of heart failure also mentioned. If you take in combination I13 that time we will code also I15 whatever is mentioned, acute diastolic systolic whatever mentioned in your record, so we will code also. This is a mandatory, as well as CKD chronic heart failure, that is a CKD type 1 to 4, that stages mentioned in that code. So that code also we will code is a mandatory. CKD code is the N18 series. I'm clicking N18. Where is C? The CKD stages. That CKD stage also mandatory to code in if you are taking the I13 combination code. What is mean? It means combination code if you are taking I13 hypertension with CKD with heart failure. So in that type of conditions, we will identify which type of heart failure, which stage CKD. That's why we will coding separately. So here guys, part B is also done. It's very easy general coding guidelines. So next part C, it's important chapter specific coding guidelines. So every chapter we will study in detail. Then all chapter specific coding guidelines we will see in next video. Thank you so much.